muscle weakness, for sure, sometimes flaccid paralysis, and you will get that parathiasis where it's like that tingling sensation. So what are we left with? D. Very good. You will not see migraines. So remember, they were asking, what do you not expect to see with acute hyperkalemia? So that one was definitely confusing and could definitely trip people up in the NCLEX, but migraines are not a symptom of hyperkalemia. A patient's chart indicates a history of ketoacidosis. Which of the following would you not expect to see if it were acute? So we're talking about acute ketoacidosis. Acute ketoacidosis, what am I not going to see? What am I going to see? What am I not going to see? Let's choose what we're not going to see. Nausea and vomiting, definitely going to occur. Extreme thirst from increased water loss, yes. D, an acetone breath smell, yes, classic.